Now today we'll be talking about the uh, MRI brain lesion, where we have a confusion between NCC, that is neurocystocercosis, MRI lesion, or tuberculosis or tuberculous brain lesion, that is called tuberculoma brain lesion. Now we must know that the size of the neurocystocercosis lesion is very commonly less than 2 centimeter always. Whereas for tuberculoma, the lesions may be very, very large and they are very commonly found to have more than 2 centimeter of size. In NCC, they are very discrete, usually, and they are in different location. Whereas in tuberculoma, these are definitely discrete, but conglomeration is very common. So there can be two lesions which may fuse and may appear as a large lesion. Whereas in NCC, these are very, very discrete and usually very much located in different areas of the brain. So neurocysticercosis, there are multiple lesions, and these lesions can be maybe in hundreds as well, thousands as well. Whereas in tuberculoma, this number is usually very less, maybe 3 to 4 to 5 to 6. So they are few, discrete, but they may get conglomeration as well. So because of the large size, they very commonly may be present with meningitis, which is very uncommon with neurocysticercosis. When we do this MRI spectroscopy of these lesions, this MRI spectroscopy very typically shows the amino acid peak in neurocysticercosis, which is not a feature of tuberculoma, where this tuberculoma shows lipid lactate peaks on this spectroscopy. So this is very important thing that we need to remember. And as these tuberculoma lesions are very much large, they usually have very much marked edema or swelling around this tuberculoma lesion. That is the reason why they are very commonly present with convulsions or focal neurological deficit. Whereas in neurocysticercosis, this type of focal neurological deficit usually is very uncommon, and patient may also present with convulsions. As I told, the edema is significantly present in tuberculoma patients, whereas this edema is usually not there, or it can be very mild in NCC or neurocysticercosis. Because of this size, they have very tendency to increase the ICP, that is increase intracerebral pressure, that can also cause headache or photophobia as well. Whereas this symptoms of raised ICP is very not much common in NCC, and if it is present, it is very transient. As we know, this tuberculoma cannot directly come from air to the brain, so it always is commonly associated with lung TB. So patient usually have pulmonary tuberculosis, and the reason behind that is very commonly the family history of the patient, or someone of the patient, usually the mother, father, or any close relative or close friend, usually has TB, and from them they acquire tuberculosis of the lungs, and this TB lung then over a period of months or years transmit to the brain, and these lesions then increase, and when they are in sufficient large quantity with edema, that time the patients present with symptoms of convulsions or focal neurological deficit, which is very uncommon with NCC, because in NCC there is usually no history of tuberculosis. So as we know that patients very commonly have pulmonary tuberculosis, the constitutional symptoms of like weight loss, chills, or history of fever is very maybe common in tuberculoma patient, whereas it is not common with NCC, neurocysticercosis. Very commonly, whenever the patient has TB, tuberculoma of the brain, because of the high inflammation rate, because of the increased size of the lesion, they may have vasculitis, they may irritate the blood vessels and cause stroke, whereas this is very uncommon in neurocysticercosis. And whenever we are talking about different lesions that may be presented with these diseases, tuberculoma, they are usually large, they may conglomerate, they have significant edema, whereas in NCC, they are very small and they may present in different format. So they may present as a ring enhancing lesion, they may present as a calcified granuloma, or they may present as a scolex lesion. Scolex lesion is like a ring enhancing lesion on contrast, and usually an eccentric dot. This eccentric dot is what is the scolex. Scolex means the head of the NCC. Whereas in tuberculoma, they are usually only ring enhancing lesions which are large in size. So these are the all points which actually helps us to find the likely etiology of whether it is NCC or tuberculoma. Thank you.